So first step in GFC treatment is you must make patient pain free. So I always prefer to give an scalp block before starting my treatment. Now GFC is basically a better version of standard PRP, that is the platelet rich plasma, and GFC stands for growth factor concentrate. Now let me tell you the basic science behind the GFC or a PRP treatment. As we know, whenever we centrifuge a blood, it gets separated into layers. The topmost layer is plasma, the middle layer is platelet with WBC, and the lowermost layer is RBC. So we discard the RBC and then we take out the plasma along with the buffy coat and we inject into the scalp in case of PRP treatment, with the intention that all the platelet will burst out and release their growth factors. But it has been seen that some of the platelets may not burst out and release the growth factors. So that means there is some wastage of platelets in PRP. Then one school of thought says that you have to add a platelet activator so that the platelet will burst out, and some other school says that you should not add any platelet activator because the tissue thromboplastin helps in breaking down the platelets. So in order to overcome this drawback, the GFC is there, that is the growth factor concentrate treatment is there. So in GFC what happens, we take out patient 16 ml of blood in a special tubes. Then we allow that tube to stand for 30 minutes so that platelets which are present in the blood will release the growth factors in the tube itself. So irrespective of the platelet count, all the platelets will release their growth factors into the tube itself. So there is no wastage of any platelets. And then we centrifuge those tubes at 3500 RPM for 10 minutes. So in the upper part of the tube we get a plasma containing good concentration of growth factors without any cell. That means there are no RBCs, no WBCs. So GFC is purely acellular and having high concentration of growth factors. That's why it is known as GFC, that is a growth factor concentrate. And then we inject GFC solution into the scalp at the level of dermis. That is, our target is that the growth factor should be at the level of bulge area of the hairs. As we know, in bulge area there are maximum number of stem cells. So these growth factors will stimulate these stem cells to generate hairs, increase their blood supply so that there is a decrease in hair fall, fast growth of hairs. The hairs will become thicker, more pigmented, and it will stimulate the resting follicles to grow back, as well as some of the senescent follicles which are still living but they are not growing. These growth factors will push them to grow into the scalp so that there are more number of hairs on the scalp and the scalp looks fuller. Bye-bye.